What comes to your mind when you hear the word anxiety? You might picture yourself getting nervous before taking a test or giving a presentation at work. Or you might think about a time when you were faced with an all-consuming fear that seemed to take over every aspect of your life. I'm Allison Gibson, Director of Integrated Care at Mercy Community Healthcare. Today we're going to talk about the different levels of anxiety and what to do about them, whether that's through self-care practices or seeking professional help. Common symptoms of anxiety include feeling nervous, restless, or tense, struggling to concentrate, experiencing difficulty sleeping, being unable to control your worry, and more. The basic form of anxiety is mild anxiety, which everyone experiences at some point. Mild anxiety may come in the form of social anxiety or shyness. If left unaddressed, it can lead to negative coping strategies or behaviors. Mild anxiety can be managed through self-care. The next level is moderate anxiety. In this case, people have more frequent and persistent symptoms, but for the most part are able to maintain daily functioning. Individuals may feel on edge or be unable to control their worrying for several days of the week, but anxiety is not affecting them every day. Depending on the person, moderate anxiety can be managed through the help of a doctor, seeing a therapist, or possibly self-care activities. Lastly, there is severe anxiety. Severe anxiety is debilitating, leaving individuals with high stress and a lower ability to function. Symptoms are frequent and persistent, which may include increased heart rate, feelings of panic, and social withdrawal. In addition, individuals with severe anxiety may turn to alcohol and drugs as a way to cope with their symptoms. Anyone with severe anxiety should seek clinical help. Thankfully, there are resources available to those who are looking for support in managing their symptoms. Medication is not a cure for anxiety, but it can help relieve symptoms. Medication is prescribed by a psychiatry provider or a primary care doctor. Therapy is another resource for anxiety. Here, an individual meets with a therapist who listens and talks to them about how to manage their anxiety. Therapy and medication can be independent of one another, or they can work in tandem. Outside of a clinical setting, there are many self-care practices that can help manage anxiety. Activities like reading, going outside, participating in an exercise you enjoy, or spending time with positive friends can help relieve stress. And it's always important to eat regularly and get enough sleep. If you or someone you know are experiencing symptoms of anxiety that are making it difficult to live your life, please consider talking to one of Mercy's primary care doctors or behavioral health consultants. Mercy Community Healthcare offers both short and long-term therapy options, as well as group therapy and medication management. For more information, call 615-790-0567 or visit mercytn.org.